Good afternoon. My name is Chris Rowena, Lead Communications Analyst at Health Workforce Development. We're excited that you've joined us today for the Family Nurse Practitioner and Physician Assistant, or FNP PA, Midwifery and FNP PA Postgraduate Fellowship webinar. Before we begin, I would like to discuss a few housekeeping items. Number one, our webinar is hosted in Microsoft Teams. If you're not familiar with the platform, you can view the controls and the chat feature in the menu bar at the top of your screen. The webinar will be recorded and posted on our website in approximately 7 to 10 business days. Today, the chat option will be open during the presentation and we'll answer any questions you have in the chat until the Q&A session, at which point we will switch to answering them through the Q&A session period, which will be at the end of this webinar. This slide deck will be posted on our website, and a link can be found in the chat box now, along with all other relevant links for today. And with that, I am thrilled to introduce Danielle Hatcher, Program Officer for Song Brown.
Thanks, Chris. Hi, everyone. My name is Danielle Hatcher, and I'm the Program Officer for FNP PA Midwifery and Postgraduate Fellowship programs. Thank you for joining us today. We're going to be going over the application and any updates that were made for this application cycle. And the slide deck that I'm going to be covering is essentially the same as our technical assistance guide, which is posted on our Song Brown webpage. I believe it's also dropped in the chat. When you are filling out your application, it would probably be helpful to have the technical assistance guide open so you can reference each screen similar to how we're going to go through them today. So with that said, about Song Brown provides funding to education programs, including FNP and PA training programs, the postgraduate fellowship programs, which are new this year, RN education programs, primary care residency programs, and licensed midwifery and certified nurse midwifery training programs as well. Song Brown provides financial incentives to programs that ensure or try to follow 4 statutory criteria, and that includes graduating individuals who practice in medically underserved areas, enrolling members of underrepresented groups in medicine to the program, locating the program's main training site in a medically underserved area, and operating a main training site at which the majority of patients are Medi-Cal recipients. So I just wanted to talk about those 4 items because it becomes applicable later when we talk about the application. Application release dates, as you all know, the application opened September 28th. The deadline is November 9th. It opened at 3 p.m. and it's going to close at 3 p.m. as well. So make sure you submit before 3 p.m. on November 9th. October 26th is the early submission review date. If you submit before October 26th, you'll be eligible for a pre-application review, which is when a program officer will review your application and provide feedback, after which you'll have 5 days to correct any errors or make any changes or updates before submitting again. Obviously, if you submit after October 26th, but before November 9th, you don't get that pre-application review. Changes for this application cycle. One of the biggest ones I already mentioned is the new FNP PA Postgraduate Fellowship pathway, as well as an expanding option for midwifery programs. Race, ethnicity, and gender data for students and graduates will now be collected in aggregate, and we're going to discuss that more later when I go over the actual application. And then this slide also has updated funding dollar amounts for this year as well. Before you apply, it's important that you, if your training program has to get permission from a governing body or a board in order to enter into a grant agreement, it's important that you get their approval before submitting an application. Typically, our signatures, if awarded, our signatures need to have a pretty quick turnaround time. So it's best for them to have a sample of the grant agreement language before that. And sample grant agreement templates can be found on all of our grant guides, which are on the website. And I believe they're also in the chat. Important to point out, related, is that we can't make changes to that grant agreement language. So that template, it is what it is. It can't be changed. So it's important to get approval to apply beforehand. Let's see. Information to gather before you start your application would be grant agreement and payee data record signatories. That can be the same person, it can be two different people, but it's important to have the accurate names. Names and full addresses of the training sites you used in the last academic year. You do not need to include specialty or elective rotation sites, out-of-state training sites, or those where primary care is not provided. You'll need the facility type for each training site and the combined total number of hours that all trainees spent at each training site in the previous academic year. You'll also need race, ethnicity, and gender data for all current students and graduates. The current practice site information for all graduates entered, along with their national provider identification number. And then you'll need to gather any applicable attachments. So that would be approval letters, accreditation letters, expansion letters if you're applying for midwifery expansion funding. And if you're a postgraduate fellowship, there are no required attachments for your application, but if you could attach anything, any correspondence related to your accreditation, that would be beneficial for us to take a look at this year, since it's our first year offering the program. Helpful resources can be found here. Again, this is very similar to the TA guide, so that's in a different format, but all this information is in the TA guide. So if you need these links, you can access the TA guide, and then the links should also be in the chat as well. So at this point of the presentation, the next few slides goes over creating a profile or an account in our eApp system, which the vast majority of you have already done so, but it's helpful to know that these slides are here in case you have new colleagues that need to register, or if you need to update your role to program director. So just keep in mind that these next few slides are here. They have step-by-step instructions on creating your profile, updating your profile, adding new grant preparers to your grant preparer list. But I am going to skip through this, and we're just going to jump right into the application itself, which will be slide 20. Okay, starting an application. So you're going to apply at the main eApp link, funding.hchi. Let's see. I should have put the link in there. The funding link. So you're going to, this is what it looks like when you log in. You'll click apply here on the left side of the blue ribbon, and you will see the Song Brown Family Nurse Practitioner Physician Assistant 2023 application. So you'll click that link, and only those with program director access will see the apply button. Some helpful tips when you're navigating the application. There's the previous button and the save and next button at the bottom of all the screens. If you don't see the save and next button, it's most likely because there's something missing above that's required. Or maybe all the information hasn't been entered, in which case you'll also probably see an error message at the top letting you know what the problem is and what you're missing. You do not have to finish your application in one sitting. You do have to finish the very first screen though. Thank you, Melissa. Melissa put the funding link in the chat. So you don't have to finish your application in one sitting, but you do have to hit save and next, at least on the very first screen. So the program director, it's probably best for them to start the application, fill out the very first screen, hit save and next, and then they can exit the application. And then at that point, grant preparers will be able to log in and see the already started application and continue from there. So that's what this talks about on the right, accessing your saved application. You're going to navigate to that same screen, but instead of clicking apply here on the left, you're going to click the third tab or button over that says Song Brown applications in progress or submitted. That tab is new this year. They split the grant agreement or the grant applications into 2 buttons. So any other grant applications will be that second button. The Song Brown applications specifically will be accessed on that third button. Okay, red asterisks throughout the application indicate that a field is mandatory. You won't be able to skip that. And then we've got tooltips, which are the little blue circles with the question mark. If you're ever not sure what a field is asking for, you can click that and a tooltip will pop up telling you what it is that we're looking for in that section. All right, so when you're starting your application, you're going to indicate what type of training program you're applying for. So again, we've got FNP, PA, FNP Postgraduate Fellowships, PA Postgraduate Fellowships, and Midwifery. If you have a combined program, this is where you'll need to do 2 applications. So you're going to need to do one for your FNP side and one for your PA side. For the training program, you're going to use this white magnifying glass right next to the training program field to search for your training program. If you are a returning training program and you have successfully applied in previous years, chances are your training program is in the system. If for some reason you go to search it and it's not being found, just shoot us an email rather than creating a new one so that we can prevent duplicates in the system. And if you are a postgraduate fellowship program, obviously this will be your first time applying. So you'll need to click the button just below that says training program not listed. You'll need to create a new training program. As I indicated on the last slide, you'll need to, if you're a combined postgraduate fellowship program, you'll need to create 2 training programs, one for your FNP pathway and one for your PA pathway. And then you'll need to open 2 applications, one for each. This is for new training programs. Again, if you select the training program not listed box, a new window will pop up and you'll input your address. And you'll want to put the address where the training program is actually located. So it can be the same as your organization address, but only if that's actually where your training program is being held. If your training program is being held at a different location than your organization, you'll want to input the address where the training program will actually take place. If for some reason Google can't validate your address on this screen, go ahead and just reach out to us. Sometimes it gets picky with suite numbers or zip codes. And then when you enter a new training program, it will need to be approved by somebody on the Song Brown team, but you can continue your application while we're reviewing or approving it on the back end. Okay, so that's how you start an application. So that's that first screen. Again, once you hit save and next, you'll be able to access it later. You can exit at that point. So now we're going to go over FNP, PA, and midwifery applications. A lot of this is the same as last year, but I will make sure to point out the new items. So the contract administration page is the same as last year, but I am going to point out there's a couple of common errors made on this page. There's 2 important things to note is that your contract organization name must match what is reported to the IRS. Additionally, your 204, which is your payee data record, also must match what's reported to the IRS. If you're unable or if you're uncertain what address your payment should be sent to, you should consult with your contracting authority at your organization. Incorrect information on this page will delay your grant agreement if you're awarded. So just something to keep in mind. There's also an option on this screen to enter a PO box, that's pretty new. If you have a PO box, you can enter it here. The program description section contains one required question. I know in past years there have been two, now it's only one. So we'd like your program description to address those 4 Song-Brown statutory priorities that I talked about earlier. This question will reference you to the grant guide. Page 3 of all of our grant guides lists those 4 statutory priorities if you would like to review them. And again, oh no, I'm not on postgraduate fellowships right now. We'll talk about that in a little bit. Okay, program data. You're going to select the appropriate responses on this page. If you don't have any academic year 21-22 or academic year 2021 graduates, you can select that you're only going to be importing or entering student data. Please select graduate and student data if you have any graduates from those academic years. Again, that's 21-22 or 2021. And then obviously, if you're a new program, you'll select new program and we won't ask you for any student or graduate information. If you would like to import data from a past application, this is where you'd select yes. Now we're moved on to training sites. So imported data or imported training sites will always transfer to that red section that's in the middle of that screenshot. That's considered our errors list.
Yeah, for me, I went back for a second on a piece of bread, and then they were telling everybody to take food on the way out, and the girl gave me like some bread to take home.
Okay, so any imported data that includes training sites, which is what we're on right now, any imported data will be automatically filled into that red section in the middle. You're going to need to review each training site that's imported from last year. There is a new question this year as well in regards to the training sites. The screenshot is that smaller one. It's a little hard to read, but it says provide the total number of hours that all trainees combined spent at this site in the previous academic year. So it's a brand new question. So even on your imported sites, that's going to be blank. So you're going to need to go into each record and input that information. Then you will click a box that says training site has been reviewed for accuracy, and it will move it down to the green section of the application. And that's the non-errors list. This is also where you're able to add new sites. So if you didn't import any data, you'll just click that blue box to add a new site. A new window will open and you'll just answer all of the questions. You'll need to select the facility type that best applies to the training site. If your training site doesn't fall under any of these facility types, you'll just mark not applicable. And it's important to point out that some of the information found in the training site section includes scored criteria. So it's important to make sure that everything is accurate. And if you need more information about scoring, you can find that in the grant guide, attachment A. So all of the grant guides, attachment A has the scoring criteria for all the pathways. The next screen is funding and expenditures. So here you'll put in how many slots you are requesting funding for. The number of slots requested for funding cannot exceed your total number of filled first year slots. And then down below, you'll put in last academic year's expenditures. Those expenditures need to be equal to or greater than the total amount that you're requesting. So it can't be less. Your expenditures can't be less than what you're requesting. Okay, student data. Again, if you've imported student data, all of the students will be transferred over onto that red section that says there's errors. We just want you to go into each record and confirm that it's accurate. Once you confirm that it's been reviewed for accuracy, it will move down to the green section of the application, and you'll be able to advance past the screen once everyone's in the green. You can also add new students here, similar to training sites. You'll click the blue button where it says add a student. Then you'll want to review all of the students. Again, please ensure that only valid student information is listed and that any data issues are resolved before continuing. You'll hit save and next, and then you'll go to the student data aggregate page, which is new this year. So there won't be any data. Even if you chose to import data, there won't be any data in this section. You're going to select add data to add the race, ethnicity, and gender of students enrolled in each academic year. Each cohort should be entered in aggregate in one line item. So if you have 2 cohorts enrolled, you will have 2 academic years worth of data. And if you have 3 cohorts enrolled, you'll have 3 lines or academic years of data. So that's just something to keep in mind. Please note that student data aggregate is a scored criteria as well. So if you need any more scoring information, that's found in the grant guide, attachment A. After that, we've got graduate data, really similar to student data. You're going to want to review any imported graduates and move them to the non-errors list while you review them. You can add new graduates using that blue button again. A pop-up window will appear and you'll want to complete all the required fields. You'll want to obviously review any new and imported graduates. One important thing to point out with graduates is we do ask for their practice site information. For all graduates entered, you must add their practice site information unless they're working outside of California. And in fact, we're asked if they practice outside of California, don't put their address. So you'll want to click I'm going to go to the next page real quick. You'll want to click this or select no. Is their practice site known? If they're not practicing in California, you're actually going to select no. And then there's in this drop down, you'll select that they are practicing outside of California. So even if it is known, but it's outside of California, just put no here because we don't review practice sites outside of California. So just one thing to point out is that graduate practice site information is also a scored criteria. So just make sure you enter valid information here. Then we've got graduate data aggregate, which is very similar to student data aggregate. You're going to enter each cohort on its own line. And this is new this year. You're going to be entering the race, ethnicity, and gender of graduates from each academic year. And this is a scored criteria as well. Then we've got required documents. This is where you attach documents pertaining to your accreditation and your expansion, if that applies. You can see on the left, the top left screenshot, there's a red button under approval letter. So that's indicating for this application, an approval letter is required and it hasn't been uploaded yet. But after you upload it, it will turn green and then you'll be able to click save and next once all the required documents have been uploaded. Then we have assurances. You're going to read the statement and certify that everything you've entered is accurate and up to date. And then you can hit the submit button. Program directors can only submit an application. So if you're a grant preparer in the e-app, you won't see the button to hit submit. So if you've been completing the application on behalf of your program director, this is where you'd want to save and exit and then let them know that it's ready for submission. So just a reminder, program directors have to initiate and submit. They have to do the first and final steps, and then grant preparers can do everything in between. Once you hit submit, it will give you a confirmation screen. And then back on the main screen, you can view your application, you can print your application, and that would be in that tab, Song Brown Applications in Progress or Submitted. So very similar to last year for the FNP, PA, and midwifery. Now we're going to go over the postgraduate fellowship application. It's really similar. I'm going to point out the differences. And then I'm also going to point out, if you're a combined program, what we'd like you to do, because we're asking you to split the two pathways and build two applications. So the same points apply here for the contract administration. Just make sure you get the correct organization name, the correct signatories. If you're awarded, having incorrect information on the screen will impact the timeliness of when your grant agreement is executed. Again, there's a PO box option towards the bottom here. If you have a PO box. On the program description page, again, this is a one question essay type response. If you're a combined postgraduate fellowship program, we'd like you to mention that here, that you are a combined program, but then we'd like you to specifically talk about the pathway that you're applying for in this application. So if this is your FNP postgraduate fellowship application, if you could try and speak to specifically your FNP postgraduate fellows, what they'll be doing in your program. Again, we're looking for ideally program descriptions that address those 4 Song-Brown statutory priorities that I discussed, which you can find in the grant guide, but try to specify it towards which pathway you're talking about. Program data, this screen will ask you if you'd like to import data from your last application, but obviously this is a brand new funding opportunity, and so there won't be any data for anybody to import this year, so just make sure that that stays marked as no. So everything is going to be new. You're going to be adding new training sites, new student or new fellow data, and new graduate data, basically on all the screens that we've already discussed. So to add a training site, again, it's the blue button. A window will appear, and you're going to want to enter all of the required information, which includes the facility type. And again, if your training site doesn't fall under any of these facility types, you're going to mark not applicable. And this, similar to FNP, PA, and midwifery, this information includes scored criteria on the training site facility type. For payer mix, this is unique. This question is unique to postgraduate fellowship programs. We ask for your payer mix at the training sites. So it doesn't need to equal 100% across the 3 fields. You just need to enter the percentages requested. And this is also a scored criteria. After training sites comes program funding and expenditures. This is very similar to the other application that we discussed, FNP, PA, and midwifery. So again, the total number of slots requested for funding cannot exceed the total number of filled first-year slots, and your annual expenses need to be the same or higher than the amount that you're requesting. In the postgraduate fellowship application, at this point, you'll see a lot of references to students, but what we mean is your fellows. So we're asking for fellow data here. It's going to say add a student, but you'll be adding your fellows. So once you click the add a student button, a window will pop up and you'll complete all of the required fields. Again, if you are a combined postgraduate fellowship program and you're applying on the FNP side, please only enter your FNP fellows here. And if you're applying on the PA side, please only enter your PA fellows here. This is where we need you to try to keep it separate if possible, which reminds me, on the previous slide, funding and expenditures. If you're a combined training program, you do not need to separate your funding and expenditures on this screen. We understand the chances of you being able to separate the 2 budgets are not likely. So you can put the same funding and expenditures for both of your pathways if you're a combined program. That's totally fine. But for fellows, if you could just include your FNP fellows on your FNP application or your PA fellows on your PA application, that'd be great. And then you're going to obviously review them all. Make sure you don't have any on the errors list. That's probably unlikely if you're adding them and not importing, which none of you guys will be. You'll click Save and Next, and you'll be taken to the fellow data aggregate page. This is very similar, basically the same as the student data aggregate page on the other applications. You're going to want to list one line item per cohort. So you're entering race, ethnicity, and gender data in aggregate for that entire academic year. And then again, for if you have a second academic year. This is a scored criteria, so make sure you've got updated information for everybody. Then we've got graduate data. Again, you're going to add your graduates. A window will pop up and you can complete all the required fields. Similar to the fellow data, please on your FNP postgraduate fellowship application, add your FNP graduate versus the PA postgraduate fellowship application, you'll want to add your PA graduates. You'll want to review them, make sure they're all on the non-errors list. And when you're reviewing them, make sure you enter valid practice site information. Again, if they are outside of California, just indicate that you do not know their practice site. And then for the reason, just put outside of California. This, the practice site information for the graduates is a scored criteria as well. This just reiterates if they're out of state, don't enter their address for their practice site. On the graduate data aggregate page, really similar to the fellow data aggregate page, you're going to enter each cohort in aggregate, and we're asking for 2020-21 and 21-22 graduates. So just 2 years of graduates. So you'll only have 2 lines of data here. This is also a scored criteria. Okay, and then we get to the required documents, which again, for the postgraduate fellowship pathway, I don't believe there's anything required, but we would appreciate if you could upload any correspondence related to your approval or accreditation. You can add that at the bottom where it's yellow. Yellow indicates it's optional. So if you have any correspondence about accreditation or approval of your training program, we'd appreciate it to be uploaded here. Then there's the assurances page, similar to the other application. Only program directors, again, will see the submit button here. And then your submission is complete. And back on the main screen, you'll be able to view and print your application using the drop-down button on the right. Some common application errors. I tried to touch on these when I was going through the slides. These are things that might delay your application. Putting an incorrect signatory for either the grant agreement or the payee data record, having incorrect or missing required documents, incorrect facility types, outdated remit to addresses. Just if you're unsure about anything, check with your contracts office and make sure everything's current and up to date. Having an incorrect training program name, missing data, or inconsistent data. Those are some of the most common errors that we come across. And so at this time, we'll turn it over to questions. You can always email us if you have a real specific question that's, pertinent only to your training program. That's our email address right there. And then Chris, I'll turn it over to you to read some questions.
All right. Thank you so much, Danielle. As you can see, the team's put a lot of work into this program, and we're excited that you've joined us today to learn more. We're going to transition into our question and answer session. The chat has been open, and you guys have been already asking great questions. I am going to go over the questions that have been asked already, just to make sure those get in the recording for anybody who views this later. And then we will continue to answer questions as you guys answer them. So first off, again, songbrown@hchi.ca.gov for any questions that we can't answer here. Question number 1, how do we record multiracial students? Are they not listed, or do we break down and mark credit in the individual categories? If it's the latter, the numbers won't match. And the answer for that, thank you, Melissa, for the answer, was for this application cycle, you would choose other not listed. Question, will you be able to get a copy of these slides? The answer is yes. We have these slides linked in the chat at the top. They're also on our website, and so they are available. And it is the technical assistance guide that has been provided, is the slides are based off of. So let's see. Next question.
It's from Lisa Fisher about
Lisa-
the
Didactic sessions.
yes.
Yep. Thank you, Melissa. We have didactic sessions held in one place and the residents are housed in different health centers. Do we need to list all sites? And let's see. The answer for that is I don't believe you are required to include all training sites. There are specific requirements that each training site must meet before adding it to your application. All right. And we had a question about, does the character count include spaces? And the character count does include spaces, punctuation. Each character is included in that. All right. And then first
Real quick,
question.
Chris.
Yeah.
Sorry. So if you copy and paste over from a Word document, just make sure that the full body of the text got copied over, because it will cut off at the 2,500 if you're worried about that character count.
Great point. Thank you, Danielle. All right. First question from the Q&A session. Do organizations need to be accredited in order to apply from the postgraduate fellowship program?
So that is something I will need to follow up with. Melissa, do you want to take that question?
Yeah, at this time, we're not requiring that postgraduate fellowship programs, the NP and PA postgraduate fellowship programs, be accredited. We're trying. We would like you to provide any information. If you have accreditation, please provide a copy of your accreditation documents. But in doing our research, we see that there are many accrediting bodies for these postgraduate fellowships. And so we're trying to get an understanding of all of those different bodies before we make it a requirement possibly in the future.
Right.
All right. Thank you, Melissa. Next question. Do we need to provide the pair mix for all clinical training sites we list on the application?
Yes, please.
All right. And these are all great questions. If you have any more, we do have more time in the webinar, so please get your questions in. Real quick, as we're waiting for any more questions out there, just a reminder, songbrown@hchi.ca.gov. Also, if you look in the chat up at the top, we have a number of quick links. I'm going to go ahead and pin that right there to the top so you can see in the chat there is a pin icon at the very top of it. Click on that and you'll see all of the other resources that we've linked to today's webinar. All right, give it another minute here for anybody to answer some questions. Well, or ask some questions, excuse me. And as we give you that minute here, I'd like to mention again that this session is being recorded along with the session from this morning. And in about 7 to 10 business days, we will have those recordings captioned and posted online. Additionally, we will send those recordings out to everybody who registered. So we will get that out to you as in an email as well. And it looks like we're not seeing any more questions. So we really appreciate you participating with us in the Q&A session. Oh, there you go, Lisa.
Yeah.
Thank you. What is the benefit to early application?
So early application, we will review any applications that are submitted early and give feedback on, maybe we're noticing trends across the applications where, a couple people can score higher by providing more information if they have it, like maybe they left some things blank. So it's a time for us to give feedback on your application, and then you can update it before November 9th. Whereas if you don't meet the early application deadline and you apply between October 26th and November 9th, that's it. That's your only submission. But if you apply between now and the 26th, we'll do that one-time early review for you.
All right. Thank you, Danielle. And Lisa, thank you for that great question. All right. Well, thank you all for your participation in the question and answer session. Those were great questions as usual. We love getting to interact with you and make sure that we get the questions that matter to you guys answered. If you do have more questions, please email the team at songbrown.hpi.ca.gov. And as a reminder, we will be posting all of this. We appreciate everybody joining us today to learn more about the Song Brown FNPA PA training, midwifery, and our postgraduate fellowship programs. We're really excited to be able to offer them as a part of our health workforce development efforts at HCI, and we're really grateful for your participation with us today. We encourage you to go to our website to discover all of the great resources that HCI offers. And as a reminder, the early submission reviews are due October 26th, and the application cycle closes November 9th. Thank you so much for attending. And with that, we conclude today's webinar. Have a wonderful day.
Thank you.
Thank you.